Again, I wanted to thank you for being here today. Since March 2020, when COVID shut down many businesses, then businesses have been determining what happens next for them. And some of them have reopened, some of them have reopened partially, some of you never stopped, as Lisa indicated and June indicated, that they've been working all along as critical businesses, but with additional safety protocols in place. So now what do we do as we enter into this recovery phase, as the vaccine starts to make our caseloads flat or down, and as the state orders and the local orders start to change. We saw a big watershed change last Friday or Thursday afternoon when Governor Polis announced that the statewide mask order would now become a suggestion or a recommendation rather than a requirement for vaccinated individuals in non-healthcare settings. CDC guidance also changed last Thursday to give more opportunities, I guess, to fully vaccinated individuals in, again, non-healthcare settings. So what does that mean? We also had 6 counties in Colorado, including Boulder County. Scott, you may have more updated information than I do. I've been looking at their website today, moving to level clear, which wasn't even on the scale initially, if you remember that COVID dial, but it's a level that is monitoring case counts, positivity rates, and those things, but removing many of the capacity and mitigation restrictions that have been in place. So let's talk about before returning to work, what you should be thinking about. Yes, we're going to talk about the public health requirements, and you want to do your own assessment for your organization and the types of work that you do, the types of work that your employees do, the situations that they are placed in to perform their jobs, and in consideration of your constituents or your customers as well. So there is guidance on the Occupational Safety and Health Act website, or OSHA, as you've probably heard of, on how to assess those hazards and what to do in low risk, middle risk, high risk environments. Even as these public health recommendations change, requirements change to recommendations, you can still make decisions as private businesses of what safety protocols we think we do need to continue to have in place, or what ones we're going to let fall by the wayside and see how things go. So you're going to determine your organization's approach and then communicate those expectations to both your customers or your constituents and also your employees, so that everybody's on the same page about what is happening. I think there's no question that COVID has changed the way we live and the way we work. And there are some changes that are likely to be here to stay, remote work being among them. Scott and I were talking about that as I joined the call before we started the recording. There are a lot of businesses that maybe weren't fully embracing telecommuting prior to COVID, but had to, out of necessity during COVID, pivot to largely or entirely remote workforces. And your employees may really appreciate that opportunity to work remotely. Some of them may not, but a lot of them may. So I think there's a new calculation for organizations, both private companies and public sector entities, about what is telecommuting in this post-COVID. I don't know if I'm rushing things a bit, as we come out of this COVID time in our organizations. We've also seen businesses change their business model because they couldn't operate on an in-person basis maybe the way they did before. So we might be providing remote delivery of many services that our organization provides, or we might have just new avenues for people to access our products and our goods. those are likely to stick around because they worked during COVID, and it may be just another method that we can continue to deliver those services, those goods and products. I also think that many businesses didn't have a plan. You might have had a plan for fire or flood or tornado, but you didn't have a plan for pandemics. So hopefully you have through this. And as you reflect on your business's experience with COVID, what is your disaster plan or your business continuity planning going forward? Knock on wood that we ever experience a resurgence or something similar to COVID down the line. And I don't know, some people say the handshake might be going away. I don't know about that, but changes in our social interaction, right? Certainly, I think that our employers' response to employee illness is going to be very different than maybe it's been in the past. We've had that concept of presenteeism, right? Where employees come to work heroically while they are ill. That's not going to be a heroic act anymore. That's going to be something that we really do expect employees to stay home when they're sick and not to bring illness into the workforce, be it COVID or anything else that might come into the workforce. So one of the questions we're getting a ton of from our member companies is, can employers require employees to return to the office? And the answer is generally yes. And we may need to explore reasonable accommodation for disabled individuals. So those are people who have a disability under either the Colorado Anti-Discrimination Act, that covers employers with one or more employees in the state, or the federal Americans with Disabilities Act, which covers employers with 15 or more employees. And not to say that an employee can compel work from home due to a disability, but there needs to be an examination of whether the employee's health condition rises to that level and whether they can still perform all the essential functions of their job with that accommodation of working from home. Or is there some other reasonable accommodation that would allow them to still meet the essential functions of the job besides work from home? So it's an interactive process that we need to engage in. There's going to be plenty of give and take, and we're going to be determining where we go forward from there. I put vulnerable individuals on the list with a question mark because we've seen that in the CDC guidance. It's also in the OSHA guidance and in our former state public health orders, and to a certain extent in the local orders, where we had that list of people who were at greater risk of COVID. And we were required for a very long time to accommodate those individuals by not compelling them to come back into the workplace. Again, those individuals are not necessarily ones that have a disability under that first bullet. They may have been people over age 65. They may have been people living with other vulnerable folks or acting as caregivers or parents to other vulnerable individuals. So that remains a bit of a question mark of, do we want to compel those individuals to come back into the workplace, or at what point might we do that? Again, those orders have fallen away. We still have some guidance around accommodating those individuals. It's no longer a requirement, but what do we want to do as an organization if we have someone in that situation? And I would definitely say you want to hear and address employees' safety concerns. COVID is not done with us. It is still around. People are still getting it. People are still getting very sick with it. We do need to make sure that if employees are bringing to our attention things that are happening in our work environments that may create increased risk or expose individuals to COVID-19, that we are addressing those concerns. And I think we want to anticipate how we're going to handle refusals. So is this a my way or the highway situation where you do need to come back into the office? Or are we going to slow play that situation with an employee? Are we going to do some kind of hybrid? Or are we going to draw that line? And if the employee refuses to come back into the office, doesn't have, in our opinion, a reasonable basis for that refusal, are we going to let that person go? So those are the decisions that we end up having to make, unfortunately, sometimes. And I mentioned that remote work may be something that is here to stay. I'm sure you've read articles or seen statistics out there about employees saying if they aren't offered at least a hybrid or remote work kind of opportunity, that they may look for another job. And those jobs may be out there, again, because many companies have pivoted to at least partial remote work and will probably continue that. So where do you start? You want to think about, are we going to do everybody at once, or are we going to stagger? Either stagger by having only certain people come back initially and then others down the line, or stagger by having people work different shifts in our offices so there just aren't that many people there at one time. Now, there's been lots of options for employers to consider there. If an employee is offered return to work and they decline to return to work, we have had in our unemployment system the ability to notify unemployment of the employee's choice not to return to work, or choice to return to work if they've been receiving unemployment benefits. So that obviously has an impact on whether they continue to receive those benefits. If they refuse a reasonable offer of reinstatement, those benefits will be cut off. And of course, if they come back to work and start getting paid again, those benefits will end for that reason too. You do want to keep your exposure response plans in place. Again, that guidance has changed for fully vaccinated individuals. They may not, depending on how long it's been since they have been fully vaccinated, they may not have to quarantine due to exposure, but you will have unvaccinated employees and individuals that do need to quarantine. And if you have even a fully vaccinated individual who is displaying symptoms of COVID, they should certainly not be at work, right, when that's going on, and should be seeking to determine if they're among the small percentage of people who are fully vaccinated who can still get COVID. Another thing that I'm hearing a lot of businesses look at is maybe we're just going to do essential business travel at first. Many companies shut down all business travel or most of it during COVID. So let's step that back slowly because of course there's greater exposure risks when we're traveling than otherwise. And of course they should be advised to follow all the guidelines for travel. And traveling on planes and buses and other public conveyances is still a place where many of the safety protocols, including masking, are going to stay in effect, at least in the short term. I hate to say that because things are changing daily on me now. But as of May 17th, those things are still in place. And we also want to define our customer and visitor protocols. We don't want to leave that employee wondering, what do I do if I have a customer or a visitor who comes in and isn't wearing a mask? Is that cool? Is that not cool? You know, what are going to be our protocols with those individuals as they come to our workplace? Of course, we want to follow all requirements. I mentioned the Colorado mask order moved from a requirement to a recommendation, and fully vaccinated people got a lot more flexibility to operate in outdoor and in public, even indoor settings without masks. It's not entirely, there are still some locations where masks are required. And there's caveats to each of these, but schools, you know, transportation, hospitals, prisons, homeless shelters, those kinds of places are still going to have the masking orders in place. And we still have localities determining, mainly counties at this point, determining what their requirements will be. And as I mentioned, I looked at the Boulder County website this morning. They did move to level clear as of the 16th and are observing this 90-day observation period to see if positivity rates and if cases stay flat or down. So local capacity and mitigation measures are not required, but they're still encouraged. And then there's a local face mask order in effect in public indoor spaces, looked like through June 4th. So again, they might be reconsidering that, but that's was still on the books as when I checked this morning. Now, Weld County, I know a lot of Longmont employers are in Weld County, they relaxed their restrictions in mid-April. So they haven't had, they do have a public health order, but it's very limited where mask orders are required. It was daycare centers and some other childcare environments where they still had some guidance in place, but they were leaving it up to businesses to decide what to do. The CDC guidance we saw changed last Thursday, again, giving fully vaccinated individuals the ability to have some flexibility for masking and social distancing. What was a question mark last week was what would OSHA do? So OSHA is Occupational Safety and Health Administration, and the Occupational Safety and Health Act is the law that they enforce. And that law covers all private employers in the United States. So public sector employers are not required to follow OSHA. Some of them do because that's guidelines that are out there. But OSHA had guidance from January 29th of this year, which set out a whole employer prevention program for COVID. They were, again, recommendations, not requirements. But of course, it included facial coverings, social distancing, the disinfecting and cleaning practices that we've been following, as well as recommending testing and vaccination. So today on the OSHA website, there is an announcement. It's in red at the top of the page on their COVID guidance that says that they are reviewing the CDC's guidance from last week. And they're encouraging employers to follow the CDC guidance while they review and update their guidance. So we are anticipating that their guidance will change. We don't know exactly how it will change. They had been ramping up with with a new enforcement process where they were doing more inspections of certain workplaces, particularly those that had had outbreaks during COVID. Meat and poultry processing, correctional facilities, of course, healthcare in all of its forms, and assisted living and nursing homes, and those sorts of things. So we'll see if that changes. I'm expecting that it likely will in the next days or weeks that we'll hear from them. So when you're thinking about unmasking, right, I want you to start with what is best for your business, your employees, your customers, right? If you're going to throw people for a loop, if they come in and people are no longer wearing masks, right? Maybe you think about that for a few minutes. Some of your employees may be very nervous about coming back to work if masks aren't there, or your customers may not want to come in. You could have the opposite view as well. Employees who don't want to wear their masks, right? We're tired of masks in many cases, or customers that don't want to wear their masks. So deciding what is best for your business, remembering if you are a private business, you can make these decisions and then be consistent about it. Again, anticipate how you're going to handle refusals from employees, from customers. I think it's a smart idea to continue to allow whoever wishes to, even a vaccinated employee or a vaccinated customer, to continue mask wearing if that's more comfortable for them. I don't see a reason to prohibit that. And then another big question that we're getting is, what do we do to monitor unvaxxed employees mask wearing? We can, and we'll talk about this in a minute, ask employees if they've been vaccinated. We can also require them to show proof of vaccination. And at least at one point, the state order was saying if you have 80% of your employees vaccinated, then everybody can take off their masks, but you couldn't just take their word for it. You had to actually do some process to find out who that is. Well, in process of elimination, if you find out who's vaccinated, you're going to learn who's unvaccinated. And are we going to police that as the employer? Do we need to police that as the employer? And I don't mean to be evading that question. We just really don't know the answer to that. How far do we want to go? If we want to ultimately ensure that we have lowered exposure, then we would still require the unvaccinated employees to wear their masks. But many employers don't want to police that and would rather follow an honor system to basically just tell employees that we're expecting you, if you've made a decision to be unvaccinated, that you would continue to wear masks while that is recommended by the state and by public health officials. Another question we're getting, and we've been getting for a while, can employers test employees? Yes, and that is because COVID-19 has been determined to be a direct threat to health and safety. So this is not normal. We're not normally testing employees in too many settings. The EEOC, which is the Equal Employment Opportunity Commission, has said it's okay for employers to test employees before they return to work and periodically. We need to use tests that are accurate and reliable. And we can certainly ask employees if they've been tested elsewhere. Again, if you're going to set up a testing program, or if you have one in place, you want to be consistent about it and anticipate how refusals will be handled. The CDC does have a testing guidance. You want to communicate what your testing expectations are, and of course, avoid pressure tactics to obtain consent from employees. You can sometimes make it easy on employees by scheduling and making sure that the testing is paid for either through your insurance or through your company. And of course, we don't want to be in the position as employers of interpretation of results, but what are we going to do when we get that positive, negative, and making sure that we know that those test results are medical information of your employees that must be kept private. You do not disclose, in other words, the name of the employee who tested positive. You might, again, for safety reasons, disclose that an employee did test positive for purposes of notifying people of what they should do next to monitor their own health or to quarantine appropriately. Can employers mandate vaccination? That's the other question. Generally, yes. And again, we want to explore reasonable accommodation for employees who are disabled, where the disability might mean that vaccination is contraindicated for them, and where employees have a religious objection to vaccines. There are some religions that do not believe in vaccines. Like we talked about earlier with disability and return to work, we need to engage in an interactive process with these individuals to determine, can we accomplish what we need to accomplish without requiring mandatory vaccination? That could be tough in consideration of COVID. And if at the end of that process, there's no accommodation that is reasonable to remove that threat or remove an undue hardship to the organization, we might end up parting ways with that person or excluding them from the workplace for a period of time. But that's something that you should talk to your legal advisor about. Other considerations with mandating the vaccine: how are you going to handle employee refusals? Again, for other reasons. There are a couple legal reasons we just talked about that you may have to explore reasonable accommodation, but what if somebody's objecting for not one of those reasons, right? There may be many reasons someone is deciding not to have the vaccine. If you're making it mandatory, right, then likely that means that the employee is not going to be able to continue to work for you, or certainly not in the way that other people are working for you. And so before you lay down that mandate, I think you really want to think about, would you let go your best employee if that person told you, no, I'm not, for my own reasons, being vaccinated. Also, for your non-exempt employees, you do need to pay for time spent if you're mandating that they get the vaccine. So time spent traveling, some time spent waiting for the vaccine. and getting the vaccine would be paid time. For employers who are extending Families First Coronavirus Response Act leave into this year, that's optional at this point, that's not required, but if you are extending it, then employees can take that time for being vaccinated and for vaccine adverse effects. Also, employers who, all Colorado employers are covered by the Healthy Families and Workplaces Act and required to provide paid time off for vaccination and vaccine adverse effects, whether you mandate the vaccine or not. Now, we're getting very close, it seems, to full FDA approval for some of the vaccines. I've been hearing that Pfizer might be very near to that, and I can't imagine that Moderna would be far behind. But right now, we still just do have emergency use authorization of the vaccines. So we are seeing some employees bring claims because these are not fully tested, fully approved vaccines. So far, when I've seen those cases go through our court system, they've failed for frontline workers because those were the people that were typically mandated to get the vaccine early on. And we'll see how this continues to go through. Many employers are just encouraging employees to get vaccinated. And we may see that change with full FDA approval. So we might see more employers pivot to mandatory vaccination once these vaccines are no longer considered experimental. If you have a union in place, so you have a collective bargaining agreement, you have a union that represents your employees in discussions about their wages, hours, working conditions, you may need to bargain over requiring the vaccine, or I'm just going to say you will need to bargain over requiring the vaccine. That's not going to be something that you can just implement. And then incentives. I know you're getting questions or you're asking the chamber questions about, can we provide incentives to get the vaccine? You've certainly seen other employers doing it. Some employers are providing cash. Some employers are providing the in-kind kind of items. And then still others are giving paid time off, additional paid time off to what other programs might have in place for them. I'll just tell you that the law on what are lawful for wellness program incentives has been in limbo since 2016. And the concern is that an incentive might be too much and might actually cause employees to feel coerced into participating in that, whatever that wellness program might be. So the last guidance we had on this, which has been rescinded by the Biden administration, coming from the Trump administration, was that wellness incentives needed to be very small, like a water bottle, or, you know, I think it even had like a $10 gift card. Now that's may not be move the needle for your people to get them vaccinated. So business groups and the US Chamber of Commerce has certainly asked the EEOC to speed up their rulemaking on what incentives are okay, but we still don't have guidance on that. So again, I don't mean to avoid that question. We just don't have an answer there. So before mandating vaccinations, I would again look at, is this job related, right? Do that position specific analysis. What is the risk of transmission or infection? And are there alternatives to requiring the vaccination? We've talked about this local public health order requirements and the state law limitations as well. So, oh, there are other state and local limitations I want to make you aware of. Not so much in Colorado, because the bill that was proposed in this last session did not pass. But there are states that are passing protective legislation that will not allow an employer to require employees to be vaccinated. So Montana was the most recent of that. Utah has something in place that says public sector employers, so that's your governments and special districts, cannot require vaccination of their employees. And there was legislation pending, the last I looked, in Kansas, Nebraska, and New Mexico. So that's kind of happening around us here in Colorado, but it's something to be aware of as a change that may be coming down the pipe. I wanted to make you aware that our website has had, since COVID last year, a number of resources that are available, whether you're a member of Employers Council or not. That's our coronavirus resource page. Our website is www.employerscouncil.org. You're welcome to go there and review any of these items. I also wanted to get you some links to some of this stuff is, again, already changed, but some of the CDC and OSHA guidance, and then these websites are where the state and Boulder County and Weld County government are putting up their updates. So you can watch for those as we go. So let me stop my share and just see what questions you all have. We're a small enough group. If you want to just unmute yourself, you can go ahead and ask that question, or if we've got questions in the chat, we can do it that way.
Hi, I'm Jennifer. Can you hear me?
Yes.
Hi, I'm really sorry. I messed up and I thought this started at 1:30, so I missed a chunk of this. But one of my specific questions is, I've got some employees that are choosing not to get the vaccine. The 2 weeks of pay, that piece is still in place, correct? With I have to give them up to 14 days. It doesn't come out of their normal paid time off. Is that correct? And that's still in place even though vaccines are available?
Yes, the Colorado Healthy Families and Workplaces Act is still a requirement. The public health emergency was just recently extended by Governor Polis for another 30 days. And that public health emergency leave, that is one of the 2 leaves required by Healthy Families and Workplaces Act, which is for absences specific to COVID, is in place. So through mid-June at this point, and then for 4 weeks after, whatever the end or the suspension is of the public health emergency. The paid sick leave, the paid sick leave part of Healthy Families is not specific to COVID, but is up to 48 hours of time. The public health emergency is that up to 80 hours of time. So I think that's what you were referring to, Jennifer.
Yes, thank you.
Yeah, that's still around, vaccine or no vaccine.
Okay.
Yeah, so if you do have unvaccinated employees that have exposure situations, that have symptoms, right? Even if you have a vaccinated employee who has symptoms, who needs to get checked out, that leave would be available for that person.
Okay, thank you.
Yep. Other questions?
Tina, you mentioned earlier on, we were talking about employees coming back to the office and whether employers could require that and how much time and that sort of thing. But what about employers, of course, or employees that are working, their work requires you to be there in person. And of course, this has been a question that's been going on this entire pandemic. Some jobs require you actually be in that person, and the fairness of all that and that sort of thing. But is there anything available to employers or employees? I would imagine many of these cases have probably already taken place already before now, whether an employee that was required to do physical work in person at the job site, that's probably already passed by, I guess, because they would have already returned to work. But what about that employee that has physical work but still feels unable to return back to their job?
Yeah, as I said, generally employers can compel employees to return to work or to return to in-person work. And that was true even pre-vaccines, as long as the employer was following all of the safety protocols that were in place. We talked about some of the situations that you may have previously needed to accommodate. right? The vulnerable individuals, the people who live with vulnerable individuals and had kids out of school or out of care due to COVID. That was, earlier on in the pandemic, like we were dealing with those things. We still have the issue of needing to go through an interactive process with an employee who says they have a medical condition that might rise to the level of a disability. But beyond those situations, right, I do think we want to hear from that employee of what their concerns are, what their objections are, so we can try to address perhaps some of their hesitancy to come back. And I have talked to many employers that are sort of doing a re-onboarding process of this is what our new normal looks like, so that you can be safe doing your work for us in person, and our customers can be safe receiving services from you in person, so that we can try to address some of that. But if you had somebody who is too afraid or refused, you're going to have to get to a decision point as a business. You may not be able to continue to have them working remotely indefinitely, or in your situation, they really can't work remotely because they do need to provide those services in person. So you might need to move on. I would look into it first, right? We certainly don't want to lose good people out of this. And there are, people feel very differently about return to work. Some have been chomping at the bit and maybe worked when they couldn't or shouldn't have been working, but others are going to take longer to convince that this is an okay thing.
Right, okay, thank you. Any other questions? As Tina said, you can we have a small group, so just go ahead and speak up. You can use the chat if you want, or just go ahead and speak up. Jennifer, I think you had another one.
I do. I don't want to be asking too many, but I've got a circumstance where, again, I've got a couple that have not. And I want to be able to reward the folks that have done that. And right now, based on what was happening on Friday, I could say we're going back on June 1st. That gives you a couple weeks if you've chosen not to get a vaccine before, and now the rules have changed and you feel like it's in your best interest. You've got a few weeks to kind of get this done, and I will absolutely work with you. But now that nobody has to wear a mask, is it acceptable for me as an employer? I already know who the ones that aren't vaccinated are. Is it okay for me as an employer just to say, hey, without a vaccine card on my desk, you guys still need to wear masks? Your health is up to you, but what I'm saying as a business owner is I don't want you to give that to someone else. And we do have health issues because they sit in an office with people for an hour and review insurance.
Right. And I would say yes to that, Jennifer. I mean, again, our governor talked about it's not required for fully vaccinated individuals. It is recommended for unvaccinated individuals. And I was saying, as a private business, you can decide what safety protocols you need to have in place. The hesitancy you hear is we're getting calls about, some employee relations issues, right? Amongst employees who are vaccinated and employees who are unvaccinated. And that tension is very real, and in some cases turns into performance management issues that are tough. So, up until Friday, we really didn't have guidance differentiating between vaccinated and unvaccinated individuals. So the guidance was basically, let's all keep our masks on, and let's all follow the safety protocols for now. So now that we have this increased freedom for fully vaccinated individuals, and again, you got to check your local stuff to make sure that that's still in line. I think you could make that call, and you're going to want to keep an eye out for those employee relations issues coming to your workplace. And I think we also want to say that even if you're fully vaccinated, if you want to keep your mask on, totally fine with us. Mm-hmm. Because there will be people who are fully vaccinated who just feel more comfortable wearing a mask. And then, that doesn't highlight necessarily those unvaccinated individuals so much.
So I'm not going to get in trouble with any HIPAA issues by saying if you're not vaccinated, you need to wear a mask, because it's not like, I don't want to get into a situation where I've called people out and now they can say you've shared what could potentially be HIPAA issues with other coworkers. I know I'm not
yeah, HIPAA isn't applicable in this context. I know there's a lot of confusion about what HIPAA covers and what it doesn't. And certainly it deals with medical privacy. And we as employers have to be aware of, we get access to medical information that we're maybe legally entitled to because we're an employer, but it's not our information to share. So we aren't going to call particular individuals out. If you're having those conversations, you're having them privately with those individuals. We can ask if people are vaccinated. That is not a medical inquiry, according to the EEOC. We can ask for proof of vaccination. That, if you're not requiring vaccination, that is where you stop. So when somebody says, no, I am not vaccinated, we don't go into why are you not vaccinated, because that does get you into medical inquiry place. And you can only do that with current employees where you're going to make that case that this is job related and consistent with business necessity. So if you're not requiring the vaccine, don't go any further than that. Have those conversations privately. Make your decisions about how your organization is going to proceed, and communicate those generally to everyone. And then you should be in good stead.
Okay, thank you so much.
Yeah.
All right.
And we're getting a lot of those questions too. Like, employees want to know if their coworkers vaccinated. Customers want to know if their service provider is vaccinated. And I have some discomfort about sharing that kind of information on specific individuals, because that's not something that we we are entitled to it, so we can make decisions about our workplace, but can we share that with another employee or a third party? I'm not comfortable advising somebody to do that.
Okay, thank you. Okay.
Jennifer, and I'll add to that we had a discussion earlier that there'll be more, more information coming from Boulder County. We believe this afternoon, if not very soon, that may have some more additional information about masks and that kind of thing for Boulder County businesses. So stay tuned to that. Once we have that, we'll push that information out through an e-news to all the members too. So we're in this time where there's a little bit of unknown. So
yeah, things are changing pretty fast from last week to this week.
Yeah, and I feel badly, I'm sorry. So for the folks that did not miss part of the meeting, when you talked about making it mandatory, are there specific businesses that are allowed to make it mandatory and others that maybe are not? That seems very wiggly.
It's not a business to business, but the hazard assessment is going to be different based on what you're doing. Right now, most employers are encouraging vaccination. They are not requiring it. I would say that businesses that are frontline are most likely to be making that choice to require. So certainly in the healthcare arena, in the grocery and animal processing, a lot of the places that we have seen issues and outbreaks over the course of the pandemic, they may be among the first to require.
Okay. Thank you.
any other questions? Feel free to, again, just speak up or put something in the chat if you would like.
Yeah, the other thing we'll be watching for is updated OSHA guidance. So again, the Occupational Safety and Health Act covers private employers in the United States. They issued something early on this year, end of January, that did lay out pretty specific things that they felt employers should be doing. But as of today, they are saying that employers should follow the updated CDC guidance from last week, and that they're reviewing their guidance and will be issuing updated guidance. And of course, the question mark is when that happens. If it'll be days or it'll be weeks before that occurs. At least it would appear that they are planning to change that guidance from the end of January, so that that is not something that businesses have to be relying upon, from that announcement from earlier today. But we want to see what they actually say.
Tina, back on the incentives for becoming vaccinated, would you then advise, because there's been a difference in the different administrations' response or in the size of the incentive, it sounds like is what is the actual issue. Would you then say that it would be okay for an employer to offer an incentive, but just keep that incentive very small?
As I said, that last bit, the last proposed rule said you can give people a water bottle or a small gift certificate, right? And it's been rescinded, but it hasn't been replaced. So I guess I would say, yeah, I would, if you're going to do it, I would keep it small. And then my question is, does that move the needle at all for you?
Right.
So you could choose as an organization to stick your neck out a little farther. There have been companies that have offered, $100 or $200 or 2 hours of paid time off or 4 hours of paid time off, and some other things to get people vaccinated. They're going to, of course, say, I'm doing this for safety's sake, for safety of my employees, for safety of my customers. I think, yes, I would probably say keep it small for now. If you're going to do it, I would keep it small.
I have one more question, and I'm sorry. I have a friend who got COVID. They give that 2 weeks thing, but he's over 5 weeks and can't get a COVID test that's negative. And so as an employer, if I have someone that goes out, they get COVID and they're out, they want to come back after 2 weeks because now it's affecting their vacation time, and maybe they're feeling a little bit better, but they don't have a negative COVID test. What options do I have there? Or what should I do? I'm not sure.
So I would look at the CDC guidance, Jennifer, on isolation as an opportunity to return versus testing as an opportunity to return. So there are a couple of paths, and the CDC has preferred the isolation. So isolation, it's the general gold standard is 14 calendar days, and the person needs to be fever-free without medication for at least 24 hours, and their other symptoms need to have improved. So I don't know what's happening with this person, and I couldn't advise on a specific individual situation anyway. But there's both the isolation route and the checking on symptoms route, and then there is the testing route. The CDC has typically preferred the isolation route in determining when somebody can come back. And we also know that there are people that they're calling long haulers that have ongoing symptoms of COVID. So some people may need to be out longer. That is going to be a situation where we're going to rely on the medical professionals to tell us when it is safe for that person to return.
Okay. Tina, anything else that you want to leave us with? Any advice that you want to give us on vaccinated versus unvaccinated employees? Anything else you want to tell us? on how our employers should be managing this situation, at least for today, as it is on May 17th, Monday, because we know tomorrow it will look a little different. Next week it'll be even different still. So
it could be. I guess I would again just say what is best for your business, your customers, your employees. Because again, most of you on the call, I imagine, are private businesses. Some of you are public sector, and those decisions are going to be made for you. But to the extent that you are a private business, what do you think is best for your organization within the boundaries that are there? So no, you can work, you can still make those choices. I don't know that we have to be in a hurry. I guess you shouldn't have to feel that you're in a hurry to make changes if you want to get more information first or see how things play out. I don't think you'll have to wait too long.
And that's a good point. There's a number of resources available to our employers, including, of course, Employers Council. And Kathy put the web address in the chat there, so please check that out. There is a wealth of information. I was on there just recently. There is a wealth of information on their website detailing a lot of answers to our questions that we went over today, but please check back there. We're proud to have Employers Council as one of our members. And so we appreciate that connection and that relationship that we have with you, Tina, and your team. So we will go ahead and wrap it up for today. But again, please, if you do have questions as a chamber member, or if you're watching this recording later, again, I should mention that this is recorded and we will share this. But if you do have questions, let the chamber know, let Employers Council know, and we'll get those answered for you. So thank you again, Tina, for joining us this afternoon, and I hope everybody has a good afternoon.